So we are now at 49,488 total cumulative cases of laboratory confirmed COVID-19 since the pandemic began to be diagnosed and laboratory confirmed in Minnesota in early March. The median age of the Minnesota cases continues to drop quite notably. In fact, the median age of cases yesterday reached 36.0 years. So that is a drop of more than 1.3 years at the median only 1 week ago, and 40 years as the median 1 month ago. We unfortunately had 5 additional deaths from COVID-19 in Minnesota yesterday, 1 each in Hennepin, Dakota, Murray, St. Louis, and Scott counties. This includes 1 person in their hundreds, 1 in their 90s, 1 in their 80s, 1 in their 70s, and 1 in their 60s. 2 of these 5 deaths occurred in residents of long-term care facilities. There are currently 278 patients in the hospital. That is a net decrease of 4 in hospital from the day prior. 108 in intensive care, which is a net increase of just 1 in intensive care yesterday. The 773 new cases reported yesterday were on a total of 16,792 total lab tests processed yesterday. That is a steady performance and a healthy amount of laboratory testing. The 7-day average testing positivity rate is 4.7%, which is down slightly from 4.9% a week prior. But again, I want to just remind you that the positivity rate on that 7-day rolling average does have a 7-day lag period associated with it. So that positivity rate is calculated as of July 15th. So just to keep that in mind as we report on these important metrics. A metric without the lag factor, however, is a 12.7% increase in testing week over week versus a 10% increase in new cases detected over that same time period. And with that, I want to thank Commissioner Alice Roberts-Davis for joining us on the call today. Reporters had a number of questions last week about the status of PPE in Minnesota, and we're grateful to Commissioner Roberts-Davis for joining us. Please take it away.
Thank you, Commissioner Malcolm. I really appreciate the opportunity to update all of you on where we are today as a state with personal protective equipment. So since Governor Walz established the Critical Care Supplies Work Group in March, we've moved from what was really a very chaotic marketplace for securing critical PPE for healthcare workers to one that's been considerably more stable. We've been successful in acquiring PPE to the point that we've now expanded our warehouse 4 times, and we're using an additional building for overflow product. Shipments to healthcare providers go out daily across the state. The situation is still very challenging, and there continues to be national and international demand for PPE, especially with the recent surges around the country. There are renewed challenges for us for securing PPE for the state. It's been a 24-hour-a-day job, and the work has not been easy. However, I'm not concerned with our current status because of the amount of PPE in both the hospital system and the state's warehouse. We are continuing to supply hospitals, clinics, and long-term care facilities with PPE, and daycares, food shelves, and at-risk populations with source control, such as cloth masks, infrared thermometers, and hand sanitizer. As a reminder, the state warehouse is intended to be supplemental to the purchasing operations of our healthcare providers in the state. If their supply chains fail, then they should work with their regional healthcare coalitions for supplies. And if they're unsuccessful there and have only a 4 to 7 day supply of inventory, then they're able to requisition the state for supplies. Hospitals report their inventory and usage to the state on a regular basis. And in general, we're seeing hospital inventories at or near the highest they've been since the beginning of the pandemic. Since March, the challenges of obtaining different commodities has really varied. For example, in April, we had extreme difficulty in obtaining medical grade gowns, but now we have a very large quantity of them. Today, gloves have been really challenging to secure, especially those that meet our standards. We're working with vendors to ensure that all the products that are being sent have been inspected and meet the specification that we agreed upon before they ship it to the warehouse. As you know, N95 respirators continue to be a constant challenge for us to source. There are many, many models and different vendors of these masks, and the quality is all over the board. So to meet the safety needs of our healthcare providers, we partnered with the University of Minnesota for testing to ensure proper fit and filtration of any mask samples that we receive from vendors before we purchase. We also verify the authenticity of masks before we purchase them as well. Today, we're waiting for about 2 million respirators that have been approved for fit and filtration, but we're now waiting for documentation on authenticity. When we're dealing with international suppliers and a really dynamic supply chain, that can be a lengthy process, and we still do have confidence that we will receive those N95. In the meantime, though, we've continued to test and purchase other masks in the event that those masks don't come to fruition. By doing that, we feel like we're creating our own flexibility. So with regard to PPE, the state is in a considerably better position than we were 4 months ago. We planned for a scenario in which we continue to see steady hospital usage with at least one peak in the coming months. And we continuously model the data to ensure that our purchasing and inventory align with the anticipated needs. Through our work with vendors and our partnerships with Minnesota's corporate logistics, sourcing, and supply chain experts, we're creating our own supply chain to ensure that the protective equipment is here in the state and we can meet the needs. With that, I'll turn it back to you, Commissioner Malcolm.
Thanks again, Commissioner Roberts-Davis. And Commissioner Roberts-Davis will remain on the line for calls after we're done with introductory comments. Really appreciate your time and all the work you're doing to support this critical need. I'd like to just spend a few minutes in follow-up to the governor's new executive order, which was announced on Wednesday, which starts at 11:59 p.m. this evening. That being that Minnesotans must wear a face covering in indoor businesses and indoor public settings. We've understandably been getting a lot of questions about the details of the order. And to remind folks, all of the specifics, definitions, a lot of detail, a lot of frequently asked questions are available at the Stay Safe Minnesota website, which is staysafe.mn.gov. The executive order does include some specific exemptions, including people with a medical condition, a mental health condition, or a disability that makes it unreasonable for the individual to maintain a face covering. This includes people who have a medical condition that compromises their ability to breathe. People in this category should consider using alternatives to face coverings, including clear face shields, and certainly staying at home and away from crowds as much as possible is prudent for folks in this situation. Children 5 years old and under are exempt from the executive order. Pediatricians and the CDC have advised that those under 2 years old should not wear face coverings due to the risk of suffocation. And even though the exemption extends to children 5 years old and under, we believe it's a good idea for kids above the age of 2 to wear a face covering if they can do so, and for parents to support their kids in adopting that behavior where possible. And with that, I'd like to turn it over to Chris Erzman.
Thank you, Commissioner. I have kind of a wide variety of topics that I would like to share with you today. First of all, we had a visit from HHS colleagues. We're in regular conversations with federal COVID response officials, including Dr. Birx, about the status of the pandemic in Minnesota, looking at case counts, test positivity rates, localized outbreaks, and how things are generally going in Minnesota. These have been collaborative conversations about the increase in cases in Minnesota that we're all seeing in our data and what steps are being taken and could be considered down the road. We receive regular reports from the federal COVID response team, and the observations and recommendations they note are in line with what MDH has been tracking and responding to and discussing publicly. There has been a federal Health and Human Services COVID response team in Minnesota this week who have been having additional conversations with us and with our local and tribal partners to discuss the state strategies in responding to COVID COVID and what other steps might be taken beyond what we are already doing. We've had some great conversations and both sides have learned useful information. We thank the team for their visit and we look forward to working with them down the road to make sure we're all sharing useful insights and doing the best we can to protect our communities. The next topic I want to bring up is one that concerns us, and that is that we've been made aware that there may be scammers who are doing outreach to individuals pretending to be part of case or contact tracing. We've been made aware that someone received a call from a contact tracer who said that this individual had been exposed to COVID. They wouldn't tell who the contact was, but they said that the individual needed to be tested. So far, all of that makes sense and could be what you might get from a call from your health department. However, the next step is not what you should expect. They asked this individual for a credit card number so that they could send him a testing kit. We will never do that. So if you have been exposed to someone with COVID, yes, you could get a call from the health department. Depending on what sort of sharing permission the case gave us, we may or may not be able to tell you who the individual was. However, we will never ask for credit card information. We will never ask you for any money. So we just want people to be aware that that is out there and that is not something that is coming from public health. So I just want to bring that to your attention. Then I just wanted, this is another COVID topic, but I just wanted to make sure to bring up an issue as we're seeing more cases in our younger working age residents of Minnesota. I just want to remind all of us that as we're making choices about how we're engaging socially, that we need to consider all the roles that we play. So, if you're someone who really wants to get together with friends, visit a bar, go to a concert, do something that is maybe would put you in a position where you would not be able to social distance, that type of thing, before you make a choice like that, consider all the roles that you play, not just the role of friend and someone with some free time who wants to do something fun. Do you work in a childcare setting? Are you a healthcare worker? Do you have elderly grandparents? Consider all those roles, because one of the things that we're seeing now as there's much more social interaction is we're no longer seeing necessarily the workplace be the source of transmission, but rather we're seeing individuals who are socially engaged. We're seeing transmission socially that then carries forward into workplaces. And that can be really challenging if the workplace is a child care center, is a healthcare facility, really any workplace likely has individuals who are vulnerable. So just keep in mind, again, all the roles that you play as you're making decisions about how you engage socially. And then on a topic that is not related, well, it's related to COVID, but it is perhaps sadly different. Earlier today, we sent an alert to healthcare providers in response to reports of 11 suspected cases in Minnesota of severe lung injuries associated with vaping. The vaping cases in Minnesotans aged 14 to 46 years old occurred in June and July, with a median age of 18 years. Diagnosis was made more difficult because the symptoms of the disease can be similar to those of COVID-19. All 11 cases resulted in hospitalizations, with some requiring intensive care, including being placed on ventilators. The patients sought care for symptoms similar to severe COVID infection, including cough, shortness of breath. However, testing found the patients were not infected. They also responded to systemic steroid therapy. The the treatment for e-cigarette or vaping product use associated with lung injury, or the shortened EVALI. The patient said they had a history of vaping. Most reported vaping THC, or tetrahydrocannabinol, the principal and most active ingredient in marijuana. Some reported using nicotine-based products. There are similar reports of a resurgence of lung injury cases in California. This issue got a lot of attention last year, and it has not gone away. We want providers and the public to be aware of the continued dangers of vaping products and the possibility of lung injuries presenting as COVID-19. As we continue to investigate the cases of the lung injuries, we encourage people to take advantage of our free Quit Partner resources to help with quitting vaping. With this resurgence of cases, we are advising patients with a history of vaping who are experiencing lung injury symptoms to seek clinical care. In addition, because this can present like COVID-19, providers also need to conduct a test to rule this out. Thank you, and with that, I'll turn it back to Mike Schomer.
Thank you. Operator, I think we're ready to take questions.
As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the pound or the hash key. Please stand by while we compile the Q&A roster. Your first question comes from Jeremy Olson, the Star Tribune.
Hi, I just wanted to talk about the impact of the mask mandate. You're obviously aware that California had a mandate. They have seen a surge in cases despite the requirement of mask wearing. Just wanted to kind of get your forecasting. What do you see, with the mask mandate in place? Do you think it's going to work? And if so, when might we see it making a difference? How long might it take to have a dent on cases and case counts?
This is Commissioner Malcolm. I'll start and would certainly invite Chris to comment as well. I think, as we've said a number of times, we do think that the data are clear that masking helps. And it's also important to reinforce that masking isn't by itself a magic answer, that we still need to accompany mask wearing with adherence to other health guidance, specifically social distancing, avoidance of prolonged contact in crowded spaces, particularly indoors, but really any close contact of long duration in crowded situations is shown to have risk associated with it. So we think masks are a very effective tool. We think it will make a difference in transmission in Minnesota, but again, just need to reinforce the importance of also doing those other important behaviors, staying home when you're sick, lots of attention to hand hygiene and social distancing being very critical. But that said, we have been impressed by the data that has shown the impact of mandates on increasing mask usage and decreasing transmission rates in areas with a mandate versus those without. But your point is and also illustrates, or the California data also illustrates the importance of that larger context as well. Chris, anything to add?
Well, the one thing I just want to mention is that with any change that's made, it does take a little while to see the impact. And so if you recall that in June, you were all asking us, okay, when are we going to see, if there's going to be increases because of opening up, when will that happen? And we've kind of said, the incubation period is about 2 weeks, and then we give at least a week for people to, get in, get tested, and get results back to us. So we kind of look at a 21-day window. So as the commissioner said, yes, we really are hoping, based on what's been seen in other locations, that we're going to see the positive impact of this mandate, but it won't be instantaneous. I had a friend reach out on Facebook and say, oh, so like by next week, we should see the case numbers go down. No, it's going to take a while before we'll see that, just simply because the cases that were getting reported this week were exposed a number of days ago. And so same thing with next week. The impact of a mandate that goes into effect on Saturday won't be seen until we've gone through at least 21 days.
And this is the most tortured of follow-up questions, but I mean, underlying compliance with this is just the fear of the risk of COVID, whether it be death or disability. And I just wanted to revisit kind of an old question, but how lethal is COVID-19? Do you have a death rate that you're working from as an assumption in your planning now? I mean, they're talking about 3.4% in China all those months ago. What is it now, and is it reliable?
Well, I'm going to let Chris talk about the case fatality rates, which vary dramatically by age group, as I'm sure most folks remember. But again, as we've been saying, especially in recent days, while we know, and Chris can give you the specific numbers, that case fatality is much lower among younger populations. It's not zero, and we've seen very serious health impacts in younger people, even without any known pre-existing conditions. We've also seen recent reports of severe health effects showing up quite a bit later, even in people who didn't have a severe case of COVID illness or even any symptoms at all. But again, that additional critical measure, which Chris just mentioned again today, the importance of understanding not just our personal risk, but our role in spreading the virus throughout the community and imperiling other people's health, as well as making it more difficult, if not impossible, to sustain some of the opening up of our businesses and our social interactions that we so value. So, Chris, could you kind of go through the case fatality numbers that Jeremy asked about?
Sure. So, Jeremy, overall, looking at all the cases in Minnesota, so the 49,488 cases, our case fatality rate is about 3.2%. But that, as the commissioner said, varies very widely. So, and we basically look at this with the exception of the under 5 group, which is a 5-year cut point. And then we have 6 to 19. Then thereafter, they're all 10-year cut points, but the case fatality ranges anywhere from, 0.01% in the younger age groups to 59.6% in the over 100. So it's quite variable. It's less than 1% for all the ages up through 50. And then when you get to 50, it's 1.2%, 60 to 69, 5.1%, 70 to 79, 14.4, 80 to 89, 30.1%, 90 to 99, 44%, and then, as I said, over 100, 59.6%, for an overall case fatality in Minnesota of 3.2% with the cases that have been reported.
Thank you.
Yep. Your next question comes from Bill Warner, Minnesota News Network.
Hi, Commissioner, and Chris, thank you also for taking this call. I'm not sure which one of you would be the best for this, but in regards to the announcement about vaping, how much of a problem do you think this might be? Might there be a significant number of cases that actually are vaping as opposed to COVID? And what kind of advice or what kind of information can you give to people about that?
Well, I'm going to let Chris add on here again, but I think we believe that with the attention, the diligence that's going on in our healthcare system, the testing of people who are presenting with symptoms typical of COVID, we think if it is COVID, it's generally diagnosed as such and counted as such. But as Chris was relating, these cases that turned out to be EVALI were first thought to be COVID and found upon testing not to be. So that would, hence the alert that we sent out today to providers, alerting them to the fact that if they're testing for COVID in people who appear to have the relevant symptoms and not finding it, that they should check for EVALI as well. Chris, what would you add?
Yeah, the thing that I'll clarify, Bill, is that all the cases that we are counting have had a laboratory confirmed COVID test. So, it's certainly possible that there could be someone who is also someone who vapes and may have some, underlying lung issues because of that, and then also has COVID on top of it. But I don't think that we need to worry that a large portion, or really any portion of the COVID cases that we're reporting are EVALI. Our concern is that if providers see a situation where someone appears to have symptoms that are consistent with COVID and they test negative, that we want to make sure that they don't forget about EVALI, and that they consider that, although it hasn't been in the media, obviously, as much as it was a year ago, that they should be thinking about that. And we also want individuals who may be vaping to be aware that this continues to be a risk for them, and we want them to consider some of the resources that we have available for them for quitting.
Let me just do a quick follow-up on that, if I may, and that is, short of having the severe lung damage, do folks who vape have a higher risk of contracting COVID, or then if they do in fact of having more complicating symptoms that could potentially have more serious long-term repercussions if folks are vaping?
Well, certainly we know that smoking can be a risk factor, and so any activity like that compromises your lungs a bit, that is going to have an impact on how your body is able to respond to COVID. So yes, we know that smoking is a risk factor, and vaping would be part of that. So, and when I say risk factor, I mean would put you in a position where you could have more severe complications from COVID.
Thank you. I appreciate you clarifying that.
Your next question comes from David Schumann, WCCO TV.
Hi, can you guys hear me?
Yeah.
Yes, we can.
Hi, can you guys hear me?
Yes.
Yes, we can.
Oh, all right. Hi, thanks for taking my question. I just wanted to ask about, with the mask mandate starting, what will enforcement looks like? Like, where does that burden fall? Is it on the health department, on city governments, locally? And also, is there a way for people, do you encourage people to call in somewhere if they see someone not following it?
I think as the governor and Commissioner Grove described the other day, the intent here is for the mandates to help reinforce the importance of this and to help normalize the behavior and make it clear that that is the rule and that is the expectation for all Minnesotans all over the state, and not leaving it solely to local units of government or employers to set those policies. So the importance of the statewide mandate is really to create uniformity and expectations and just reinforce how very important this is. The governor said, though, the intent here is compliance. It's not enforcement. Anyone who's in a position, whether that be law enforcement or public health, or who have any regulatory jurisdictional role here, it is not going around looking to hand out tickets. But there is a petty misdemeanor penalty associated, so that someone could get a ticket for just kind of willfully ignoring the order when advised to do so. But I think the hope and the intent is that people will understand the importance of this and comply with it. Businesses, as Commissioner Grove mentioned the other day, have a requirement to help enforce the mandate by making it clear to their customers that this is part of the executive order and that they must wear a mask inside their place of business. So it's kind of a multi-pronged approach, if you will, but the emphasis very much is on education first. It's important, though, for there to be enforcement chief for people to understand that this actually is a legal requirement.
Thank you. And if you don't mind, just a quick follow-up about actually wearing the mask. Is it I feel like a lot of people will be wearing the same masks every day. Is that unsafe? How often should they be cleaned? And with the blue cloth ones, how do you clean those?
There, I think it's quite good guidance on what is a quality mask and how to properly wear it and how to care for it on the Stay Safe Minnesota site. We do advise washing cloth masks daily. And many of the masks that you commonly see that you might buy in a store, for example, a paper mask is intended for one-time use. So there's, I think, good guidance on the website, also on the MDH and CDC websites about mask wearing and mask and care of masks. But just a good routine of having multiple masks on hand and washing them daily is certainly a good practice. Chris, I don't know if you would have any more specific you'd like to say.
Nope, I just reiterate what you said, and certainly, I guess if you are using the cloth masks, what I found is it works well to have several different masks so that you don't have to wash them every night. And I hang them on the hooks that I usually hang my coat on. So it's a handy way to dry your mask.
Great, thank you very much.
Your next question comes from Chris Megan, Pioneer Press.
Hi, I was wanted to ask a little bit about that testing capacity and supplies. We've been hearing that results are taking as many as 2 to 4 days now in Minnesota, and that some labs are concerned about the supplies of instruments and reagents to process certain types of diagnostic tests. Can you talk a little bit about just where we're at with that, and do we have any risk of the long wait times that we're hearing about in other parts of the country?
Yes, Chris, this is Commissioner Malcolm, and certainly invite Commissioner Roberts-Davis if you have anything you'd like to add on this question too. The supply chain has reemerged as a concern, as we've addressed in prior days. We have had reports from some of our health systems in Minnesota that their supplies that they order through their channels have been delayed or reduced. Many expect regular weekly allocations of certain types of supplies, be that reagents or viral transport media, as well as physical equipment like the little pipettes that are used in the machines to process the samples. All of those things are under supply chain pressure. So we have had reports of supplies being delayed. Here too, we, through Commissioner Roberts-Davis' team, there's a special person who works on laboratory supply acquisition as well. So as part of our state testing partnership, we have also been, as a state, acquiring some supplies to augment what the health systems can do. And so we're always on the watch, on the lookout, and kind of trying to forecast where some of these problems may pop up. We do have a variety of different types of instruments and different types of platforms. So as we know, there's a supply chain issue with one thing, we try to coordinate that capacity so more of the volume goes to the types of machines and platforms that at least at that point in time aren't struggling with the same exact reagent. So diversifying our approach has been serving us well to date, but we are concerned that this does have the potential of interfering with our desire to ramp up our capacity even further from where it is today. We have the capacity, if everything's working as it should, to do 20,000 tests a day. We're aiming to increase that further, and so it's really the growth goal that we have that the supply chain challenges give us some concern about. But Commissioner Roberts-Davis, anything you'd like to add?
Thank you, Commissioner Malcolm. I think that's absolutely right. I think that we've been trying to be proactive and anticipate what's going to happen in the supply chain. It's just very difficult to do when it's this dynamic. And so we're trying to get ahead of it. Thank you.
And just to follow up on that, how important is a quick turnaround time for a test? Say the difference between a 24-hour turnaround time, which was sort of when we were seeing our capacity start to really grow, and anywhere between 2 and 4 days now. I wonder when it comes to contact tracing and other things like that, that the quicker you get a result, the better.
I appreciate that part of your question, Chris, because you're right. I mean, the faster the turnaround, the better in terms of being able to work with folks who've been confirmed and who may have been exposed. So that particularly when you get into the week-long or more delays that some of the national laboratories are reporting, that really starts to interfere with the impacts that we can have through that very important case investigation, contact tracing work. So, Chris, anything to add?
Well, I'll just say that, yeah, absolutely. When there are delays in getting results, it means that we can't be as effective in our work. But to build on that, so that means that, and I know this is a very frustrating thing to ask, but for those individuals who are waiting for their results, it's really important that you are staying out of circulation and not out and about, because you may not hear from us, but that doesn't mean that our message to you would have changed, which is, you need to isolate, you need to make sure that you're limiting contact and be thinking about who you may have been in contact with, the early part of your symptoms and the 48 hours before. So I just want to let people know that as frustrating as it is, we do ask that you continue to isolate yourself while you're waiting for your results, because that is going to make a difference in reducing transmission.
Thank you.
Your next question comes from Catherine Reichert, Minnesota Public.
Hi. I would like to hear more about this visit from Health and Human Services. What sort of recommendations did they make to the state? And also, what should Minnesotans make of that visit? Should they be concerned that Minnesota isn't doing enough to spread of the virus here?
Catherine, this is Commissioner Malcolm. I'll start, and Chris has been participating pretty much on all of the different meetings. These were virtual visits done via Skype and the like. We are glad that they came. It was a great exchange of information. It was very collegial, as Chris said in her opening comments. They were very complimentary, frankly, to our local partners, our tribal partners, to the epidemiologists at MDH, and really to the state as a whole for all that we're doing. We're trying to collect and are collecting, as much data and analyzing it in great depth as they've seen anywhere. Just we're extremely complimentary about the depth of our data and our analysis of that data. The fact that they came, I think, and they've been deploying, this is called a Coronavirus Rapid Assistance Field Team, or CRAFT. And this is an initiative that HHS started just within recent weeks. So it's a new program, and they certainly deploy these teams to hotspots around the country. Have been doing that for the last number of weeks, but more recently, I think just even starting this week, they've started trying to get one step earlier and come to visit states where there is case growth, which is unfortunately most of the country at this point. So they're not waiting for jurisdictions to be already clearly in crisis to come and have a visit and review what we're doing and give us any advice. We just had our final session this morning, so they have not compiled all of their recommendations yet. In our concluding conversation this morning, they said they frankly weren't going to have a lot of recommendations that we haven't already been thinking of and working on, but they will have some specific suggestions for us on very specific things that we talked about. best practices in terms of engaging, specific vulnerable populations and the like. We did ask them a number of questions, and they're going to be one of the things they offered was being able to pull in other subject matter experts to give us feedback on specific kinds of data or questions that we were interested in. So the message I think to Minnesotans is this was a helpful visit. Doesn't indicate that we're in some crisis that we haven't been talking about, but as Chris said, we've been talking a lot for the last couple of weeks about the fact that our cases are growing and we're concerned, and we need to really double down on complying with the health advice and the executive orders that have been issued.
And just a quick follow-up, Dr. Burke said earlier this week that Minneapolis is among, I can't remember what college she said, Minneapolis or the Twin Cities, but either way, that it was on her, sort of their list of potential hotspots or hotspots. Do you agree with that assessment?
Well, we've, again, I think the federal government is seeing the same data that we're seeing and seeing the same trends. And certainly, we have been noting the case growth. The dial back measures that we post daily have gone in somewhat the wrong direction in the last couple of weeks. So none of this is a surprise. I think in terms of Minneapolis in particular, there was nothing specific that the federal delegation that was here offered or opined about with regard to Minneapolis. But certainly, this is a major metropolitan area that's seeing a lot of case growth, as are many others, and we're working hard to try to stay on top of analyzing what is going on and what we can trace that case growth to. And as Chris has said several times, it's significantly driven just by increases in social interaction. So less about specific workplace outbreaks and more about just the degree to which folks are moving around and interacting. Chris, anything more you'd say about Minneapolis in specific?
I'll just add that the City of Minneapolis Health Department did participate in these briefings, so they shared what they were doing, and they were part of the conversations with the HHS staff. So just to make sure that you're aware of that. And then just to add to what the commissioner said, yes, we had heard that comment about Minneapolis as you had, but in our conversations, that was not the ultimate focus. We looked at, certainly where we were seeing hotspots, we were seeing cases, but also what would be good for the whole state.
Okay, thank you.
Operator, we have time for one more question.
Your final question comes from Walker Ornstein from Mintos.
Hey, everybody. Thank you. I appreciate it. Just to jump in, there was an earlier question about turnaround time for testing. There's a report out about states like Montana that are actually trying to salvage or boost their own testing programs again. So kind of not relying so much on private testing. Does Minnesota have any plans? I know you talked about trying to diversify the testing, supply chain stuff, things like that. But do you have any plans to try and increase the actual state lab testing in any way because of any turnaround time problems?
Yeah, it's a great question. And yes, I think
The freedom to live without fear, to jog where we please, to wear a hoodie. The freedom to breathe. Before we celebrate the freedom most Americans have, we must fight for the freedom all Americans deserve. Because all lives can't matter until